in today's lecture, we will be briefly discussing the editorials more than anything else. Okay. The rise and risk of health insurance model in India. Instead of just summarizing this issue, let's link it back to the topic of health and what we should be learning on the overall picture of health. So, the topic of health should be seen as GS1, social issue, GS2 as an issue of governance and welfare, and GS3, the economic cost involved in healthcare, and finally GS4 as an element of human dignity. These are the four dimensions of health. Okay. Do I have to repeat again? When I say it is a social issue, access affordability of healthcare is, there are two facets: access and affordability. So this is related to presence of infrastructure and which social groups are able to access healthcare services. And when it comes to affordability, it is again related to how it is linked to the aspect of poverty. Okay. So imagine a situation where an already poor family, which is facing social marginalization due to issues like casteism, that kind of a family faces an health issue. They don't have government IDs or any services that they can avail. In such kind of a situation, a health issue will be even more troubling for that family. When I say access, it is about the urban rural divide. That is one dimension. You will have more hospitals in the urban areas than the rural areas. And another dimension of access is there any discrimination? We discussed the concept of necropolitics, if you remember. What is the idea of necropolitics? Where there is a treatment of, where there is a treatment where human beings are not recognized for their dignity, as if they're treated as if they're second class citizens in the very same state that they're residing in. These are the facets of the social issues of healthcare. Now, when it comes to governance and welfare, you have to link this topic to GS3, budgeting, and also inclusive growth. This is what I meant by economic cost. Okay. Now, when we're talking about budget and inclusive growth, an essential element of factors of production: land, labor, capital, enterprise. And when we're talking about labor, basically we're talking about the human resources. We're talking about the human capital. Now, what strengthens human capital? Investments into 1. Health, 2. Education, or skills. It is in this multiple ways the concept of healthcare is related to our syllabus. Clear? Now, when we are talking about the GS4 angle, what values should we focus on in ethics of healthcare? Can you give me some keywords here? See, from the standpoint of the state, first there is duty ethics. Duty, or the idea of dharma. It is the dharma or the duty of the state to ensure that every individual gets access to healthcare. Okay, that is one dimension. Second, if you take individual stakeholders in the healthcare system, take a stakeholder approach. In this stakeholder approach, you will decide the ethical perspective depending on who that stakeholder is. Let's say, if you are an investor in healthcare, of course you will be looking at profit. That profit should be ethically driven profit. For a private player, it should be based on element of trust and empathy. But if you are a doctor, what is the ethical perspective here? You are under an oath, Hippocratic oath, which says that you will safeguard the health of the patient no matter what the situation is, irrespective of the character of that person. You are abiding by the duty that you are bound to do. What if you are the state? The state's duty, as we discussed, what constitutes this dharma? If we go into the depth of that concept, what is the necessity there? One, you have regulation. Two, after regulation, you also have, what else do you have? Provision of the service. Clear? So we discussed about GS1, we discussed about GS1, we discussed about GS3, and linked it to governance and welfare. And within that, you will also see element of human dignity, because it is the state's dharma or responsibility to protect its citizens and the healthcare of the country, healthcare scenario of the country. This is how you interlink 4 papers. Clear? Now at the heart of this, what do we have? The end objective is healthcare. Now what is the definition of healthcare? We already discussed this. World Health Organization says that health is not absence of disease. It is a state of well-being. Okay. This is the end objective. What is the end objective? Well-being. How will you achieve this well-being? What is the modus operandi, or what is the governance mechanism to achieve this end objective? Today's article is a discussion on the governance mechanism that we adopted for this idea of universal healthcare. Okay. World over, there are many models of, or many approaches of achieving this universal healthcare objective. Let me break it down. Firstly, you as in the state can take the following approaches. One, it can directly involve itself in provision of healthcare services. An example for this is NHS in UK or England, Great Britain. Okay. National Health Service. Then you have the insurance driven model. The example for this insurance driven model is US, which is one of the pioneer here. Now, what is the difference between these two approaches? Let me explain. So when you're talking about the direct involvement of the government there, government will set up hospitals, it will recruit doctors, nurses, and all the necessary infrastructure. And as a part of the tax collected, a part of the budget will be spent on provision of this healthcare services, and it is hailed as one of the most efficient mechanisms. Of course, it has its own set of problems, but Scandinavian countries and many European countries follow this model. Finland, Norway, Sweden, all this have this kind of a model, where state itself is directly accountable to its people. And this model functions very well in countries where the population is very less. On the other hand, this insurance driven model is more like a PPP model, public private partnership model. When Obama was the president of the United States, there was a plan called the Obamacare. So in news, often journalists use something similar in Indian context called the Modi Care. What they're essentially talking about is the flagship insurance scheme of the health ministry, Pradhan Mantri Ayushman Bharat Yojana. Okay. So in this model, what actually happens? A household is taken. The members of that household will be given an insurance policy. If you are having any ill health, you go to the government hospital or any empaneled hospital. Now, what is the meaning of this empaneled hospital? Government recognizes a hospital which is listed on their website, and if you join in that website, you can avail this insurance. Okay, that is the meaning of empaneled hospital. India in 2018 tried to universalize this model. But even before that, many states went ahead with this insurance driven model. One of the earliest is Andhra Pradesh, the United Andhra Pradesh Arogya program. In fact, many people say that Arogya program is actually the inspiration for Ayushman Bharat, because you will see a lot of similarities in that. And it has been a huge success in the state of Andhra Pradesh during the era of Dr. Y.S. Rajshekar Reddy was the then chief minister. After that, even after the state division, Telangana adopted it, Odisha adopted it, and almost every single state, well-to-do states, brought this state health insurance policies, or simply put, ships. Okay, this is the present scenario of the healthcare provisioning model in India. The premise and the central argument is government has taken a stance of using the insurance driven route as a modus operandi for achieving universal healthcare. The central debate in this article is that viable? What are the pros? What are the cons? How do you envision this? Okay. So the analysis about this article is pros, cons, and conclusion. This is how you used to prepare till now in general studies papers, from the perspective of that single article only. But if you see the paper in this year's mains, you will essentially notice that all questions are multidisciplinary. There is an element of philosophy behind it. It is linked to economy, it is linked to ethics, it is linked to social problem. They can ask any question. Syllabus is no longer confined only to GS2 or GS3. It can be traveling here and there. The questions can appear anywhere. So thematic preparation becomes all the more important. That is why you are preparing in this model. Now, the article is a good summary, to discuss what are the good things, what are the bad things. Now, if you have to summarize the good things, can you tell me what are the good things? Yes. Does it require any rocket science to figure out what are the good things? See, when you have no insurance model, at least now, you can at least go to the hospital and get registered. Okay? Access on paper is at least now there. As a percentage of GDP, spending on healthcare increased. Okay? Now, in 1946, even before independence, you will have to remember this committee's name, and if you can quote them in your essay or GS2 answers also, it is good. There is a committee called Bhore Committee. So this committee was the first one, even before independence, to have any recommendation on healthcare situation in India. It is during that time they proposed that we increase the spending on healthcare. Finally, that is materializing. Okay. Another good thing is that vulnerable sections. One of the major problem for them that can push them into poverty is health. So, in many pockets, it has been proven that the vicious cycle of poverty induced due to healthcare problems can be broken. The chain can be broken. So there is a social cost associated with it, social opportunity cost. And this is also strengthening federalism, because it requires a coordination between the center and states. These are the good things. Okay? All right. Now, what are the bad things? Negatives. Firstly, can you tell me what is the biggest problem? Where do you see the big problem in this? Private sector is oriented towards profit. And this is not in sync with the objective of the state, which is oriented towards welfare. So, what can this lead to? What is the issue that it can lead to? Yes? Corruption. Issue of corruption. Here, one keyword that you can use is bureaucrat, politician, and businessman nexus. Another word for the same thing. Yeah, crony capitalism. Okay, this is one biggest issue of corruption. So the same issue, now I will break it down into a governance issue and an ethical issue. If I look at it as a GS2 governance issue, what is the antidote? Accountability. I want to see accountability. But if I see this as a ethical issue, no law can stop you from being corrupt if you have that intent. So this is a question of values. What can you do to stop corruption? I can bring out many mechanisms. What can you do to stop your thought? You have to address the root, the values. Now, what gives values? Your GS1 society, your um, your education, and the political environment. What is the level of tolerance for a negative value, or let's say corruption? That determines how you are. Okay. Now, anyway, let's come back. This is the issue of negative aspect of this insurance model. One more model is, one more issue is the issue of cost. Okay. What is the problem here? As of now, we are spending, if not, if you combine both state budget and central budget, almost it is reaching to thousands or few lakh crores, all the states together. Are we tracking the outcome? Is this the most efficient way to spend money? Outcome tracking. If you are spending so much money, why not make healthcare a right in this country? Same debate goes for education also. If you are saying that today in the state of Andhra Pradesh and Telangana, we are spending roughly, even on high school kids, roughly around 1 lakh, somewhere around 70,000 to 1 lakh. The primary school kids are getting a budget of somewhere around 40,000 to 60,000 per annum from the side of the government in government schools. Now, what is the outcome? How do you measure that? You have surveys like ESSER, which say that eighth class kid is not able to read second class textbook. What is the point of this spending then? I am talking about education in the same line as health because both are related to the social capital. Okay, that's why. Anyway, coming back. So, if all these issues exist, what is the solution? The answer is pretty straightforward. India can produce a lot of jobs in healthcare sector. But where? The question is very straightforward. If you take a look at the pyramid, tertiary, secondary, and primary. At the primary level, where actual India resides, this is where you can just have many healthcare practitioners, RMPs as they're called, registered medical practitioners, and healthcare workers, nurses, etc., and focus on preventive healthcare as well as even the lifestyle diseases are spreading, right? So, awareness. These are the areas. Combine them with, let's say, for example, a scheme like Anganwadi, where kids are educated. See, if you educate, let's say, for example, maybe in our childhood, we are not used to the idea of a balanced meal. We don't know what is protein, we don't know what is carbohydrate, fiber, etc. And it is very difficult to change yourself after a point in your life. What if you teach the next generation kids there? Link it to the idea of a good health. This is where you can improve on the awareness aspect. So, this author, Gendria, he is a developmental economist and he comes up with a lot of this kind of articles. So, any article that you see here will become important. Like he spent his entire life in this developmental economics. It is important. However, some of the articles can be extremely to the left orientation. So see how practical they are. But some ideas are very good. For example, he came up with a white paper on having an urban equivalent of Manrega, urban poverty. So in that scheme, he mentioned how we have to give tokens or some kind of a model where you have vouchers. You work, you take that voucher and spend it at the designated shops. Let's say, for example, you want to buy ration. Why is he proposing this model? The money should be dedicated to the purpose with which it is allocated. So he was one of the earliest proponents of this urban Manrega model. Okay. So this is the takeaway from this article. You looked at the criticism of healthcare, but what did we discuss in the class today? We looked at the issue of health from GS 1, 2, 3 and 4 and how to structure your argument rather than just the summary of the article. Clear?